It is cold and flu season, a time of year when you might want to stock up on medicine just in case, but those cabinets can get cluttered with outdated medications as well. This weekend, a nationwide campaign is encouraging Americans to look through those medicine cabinets and take inventory of drugs you don't need, and more importantly, to safely dispose of them. It's all to get results and crush the crisis. Bridget is standing by now with details in today's Ask a Doctor.
Ask a Doctor is sponsored by Red Mountain Weight Loss.
Well, the semi-annual Drug Take-Back Day encourages residents to drop off expired, unused, or unwanted prescription drugs and medicines, no questions asked. I'm here with Dr. Ross Taylor from HCA Florida Osceola Hospital, and it's good to have you here. Thanks for stopping in.
Thank you, Bridget. Glad to be here.
This is such an important time of year. You do this twice a year, but if someone's not familiar with the Drug Take-Back, how does it work?
Yes, ma'am. Great question. So HCA Healthcare is very passionate about fighting the prescription drug abuse epidemic in the United States. So we offer prescription medication take back, no questions asked. We're partnered with law enforcement to do it at our acute care locations, approximately 8 in the Orlando area. If you go to hcafloridahealthcare.com, they can direct you to those sites.
And when we look at drug abuse, prescription drug abuse particularly, this has really been something we've brought more attention to, but this has been an ongoing crisis and epidemic for decades now. What is the scope of it right now?
The scope is tremendous. Since 2010, over 1 million Americans have died from prescription medication overdoses. And prescription medications, often unused prescription medications that can sit around the house in medicine cabinets or elsewhere, they can be picked up, inadvertently taken by anybody really who's visiting, and that is a leading cause or gateway cause of addiction.
And it's one of those things. It's an undercurrent thing, because you think of drug abuse or someone who's addicted to, say, like a street drug, but this is actually like more prevalent, but it's much more quietly kept. But many people are affected by this, by like all backgrounds, and it's just something that we've cracked down on in the prescriptions by limiting amounts that are available. But like you said, it can be a child, it could be someone coming into your home to do work, it could be anyone. But a lot of people aren't aware of that part.
And that's what's so important to recognize, is that if we look at, like you said, Bridget, we often think of addiction being something of a street drug problem. And very often we do see that. We see opioid addicts in the community, but if we look at the numbers, almost 80% of those heroin addicts that we see started with prescription medications that they may have gotten, actually more often than not, got from a friend or a relative.
And when we look at multiple uses for drugs, does that give you concern sometimes? Because we see like growing wide range of use of drugs for different things.
It does. So I think your question is, if we take a medication for a reason other than it's intended, that is a sure sign that there may be a problem. Also, yes, there's a proliferation of medications across the board. Many of them are gateway medications to addiction, unfortunately.
If you're concerned about a family member or friend, are there like any warning signs or different things you might not have picked up on that could be a clue, whether it's something around the house or something about behaviors, or what would you tell people to be advised of?
There are. So to spot addiction in a friend, relative, it can be challenging, because very often they can lead very normal appearing lives on the outside, but have this growing addiction problem that they work very hard to conceal from others.
Right.
And it often, the first sign of that drug addiction can be something tragic like an overdose. So it really pays to be tuned to subtle cues. If somebody is depressed or has episodes where they're extremely depressed and then other moments where they're over the top happy, those are signs, especially if it's a change in that person's personality. Also health signs like weight loss, compulsive behaviors where they're disappearing, drug-seeking behaviors. Those can be subtle clues.
All right, and when we talk about Crush the Crisis, this is the Drug Enforcement Agency. It's a national effort that's been going on. So the hospitals, law enforcement, you all team up to offer people safe places to get rid of medicines they don't want in their house. But there's also the environmental issues as well, because we know that it contaminates the water, not just from personal use, but people trying to get rid of medications through the water system, and that's not a good idea either.
You're absolutely right, Bridget. That is not a safe way to dispose of medications. It does contaminate the water supply. Throwing them away is not a good option because those are recoverable. And the safest options are to return those either to a local pharmacy or a healthcare provider. But this Prescription Drug Takeback Day that HCA is sponsoring now for the 5th year in a row, that has been a huge success. We took back 20,000 pounds of prescription medication in 2022.
That's amazing. So this is super easy. Here's some of the locations. Now, can you tell us about the process? Do we need to take it out of the packaging? Do we need to worry about our information on the labels? And a lot of this is drive-through in some of these locations. Tell us more.
It is. So the take-back does not require you to do any of those things that you mentioned. We do take those medications back, no questions asked. You can place them in a bag. We do ask no needles or syringes. There are other ways to dispose of those, but do not dispose of them through this process. We'll take vape cartridges, no batteries, but vape cartridges. But essentially, put our prescription medications in a bag, drive to one of our HCA locations here in Central Florida, and hand them over. And we will safely dispose of them with law enforcement.
Awesome, awesome. Well, thank you for coming in, Dr. Taylor. We appreciate it. And so check that out and see which location's closest to you and clean out those cabinets. Back to you, ladies.